Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Roulette, and once again, I am joined by the senior specialist, Dr. John Trowbridge, and right now, we are talking about shoulders and how stem cells can be used to treat shoulders and just some of the issues surrounding shoulders in general. And this is one that I'm very interested in, as someone that has two bum shoulders, dislocations many times in my life. So just learning more about it. Let's just start by talking about what's going on with the shoulder and some of the issues you see your patients come in with.
Well, first of all, don't count yourself so special. I multiply dislocated my right shoulder.
Oh, now we're bragging. Now we're just bragging.
It is bragging rights. But I got to tell you, I trained in surgery and I never saw a shoulder operation that I really liked. And I had thought about going into orthopedic surgery, and it's just like, ooh, I'm just not real wild about that. And complicated shoulder repair does work surgically if you need it. If you tear things apart. The shoulder is an incredibly complicated joint. If you take a look, there's three key bones: your collarbone, your wing bone, your scapula, and the arm bone here. And if you'll take a look, they're all held together by rubber bands.
Wow.
There's nothing tightening them up except the rubber bands. And so when people talk about a rotator cuff injury, the rotator cuff is the muscles inside and outside and all the rubber bands that are holding it together. Otherwise, your arm bone would just fall off. But the beautiful thing about a shoulder is that you have all this musculature to hold things steady, so you can hold your arm out, you can hold it up, back, whatever, and you can do heavy things with it because your shoulder's that strong, unless of course it's not. And people fall, people get hit, people have accidents, whatever. They twist their shoulder apart, and that's the rotator cuff tears. Most of them are not what we call full thickness tears. And therefore they don't really have to have an operation if they don't want it. What we do with shoulders is find out, well, why is yours hurting? Because it's not like, well, my shoulder hurts. It's something about yours is more special than somewhere else. So the front of the shoulder, for instance, is the easiest part to repair, and inside can be more difficult. But you asked about stem cells. The beauty is we've been fixing shoulders for many years with what's called reconstructive therapy, or a fancy version of prolotherapy. And so I have a lot of experience treating people with shoulders. The beauty is that shoulders are just like other joints. The pain is telling us something here needs to be fixed. That's the inflammation. That's what is signaling your body, fix me here. So it's kind of easy to figure out the kind of injury. If you hurt this, you also have to hurt something else inside there. So I know what I'm doing. And so we have patients come in and go, I don't want surgery, or I don't want another operation.
That's usually what it is, right?
Very commonly. And so I go, I kind of understand. That makes sense to me too, having had my own shoulder issues. And so we go in with the stem cells with a very simple set of injections, and you go home, and it's like, okay, that was it? Yeah, that's it, because what we've done is applied the treatment to the correct area. Now we have some of the little monkey magic we do in the office to make you heal better faster. But the key is that if you go home and don't abuse it, trying to carry a piano the next day or something like that, then your body can do tremendous amount of healing. And when I say tremendous, I mean it can literally remake the support structures and resurface the gliding surface for the joint. I tell people joints have saran wrap on each side and cooking oil in the middle, so they're real slick, unless somebody throws sand into the cooking oil. And this can dramatically heal. Stem cells can allow you to become pain-free finally. And with the unique product that we use, I tell people, you deserve more. You deserve the best that I use for me, for my healing and repair.
Definitely. Now, how is this stem cell treatment, going in and doing some of the injections, different from just going in and having another surgery? How are they different?
Surgery does only two things, and it does them very well. Number one is it takes parts out. Or number two, it puts parts in. Now, if you take parts out, you're shaving or cutting or something like that. If you're putting parts in, they can either be screws or actually surfaces and things like that. And those, not quite like you. New plastic, new steel. And so what you do with this is turn on your own natural healing. Your body knows how it was put together. God gave us a great plan, And the stem cells simply go in and recruit your healing stem cells and say, all right, you guys have been too lazy, let's get to work right over here, over there, and you literally repair the structures, which means you get comfort and capability. You work the way you're supposed to.
Exactly. Yeah, I love that. Now, we talked about rotator cuffs. There's so many other issues that come along with the shoulder, from sprains and strains, dislocations, separations, tendonitis, frozen shoulders, fractures, I mean, the list goes on and on.
On and on.
Does this work for all of these
Most
situations?
of those things. And again, this is what diagnosis is all about, okay?
Yeah.
I always want an x-ray because I want to make sure there's not something funky inside there that I don't know about.
Yeah.
The second thing is hands-on. You actually want to examine the patient and see. Now, at that point, I can tell, are we likely to have a benefit with stem cells? Because you only want to do something that's going to work.
Yeah.
Oh, you want to do something safe. You want to do something effective. So the deal is that I will have patients tell me, well, I talked to the surgeon. He said, well, this won't help for me because I've got entrapment syndrome. I've got a bursitis. I've got and there's always fancy,
list goes on and on.
fancy doctor words, okay? The question is whether I, with my experience of treating shoulders for dozens of years now, whether I know that the stem cell treatment would be a proper one for you. And I got to tell you, most of the things, likely yes. But we also carefully select the patients the same way we carefully select the cells.
Very, very powerful. And one of the ways that you learn to see if a candidate is right for this is a really cool quiz you put on your website.
Correct.
On PainFreeFinally.com. You have a quiz that people can go in. A, well, there's tons of education there, so they can learn all about this. But B, in this quiz, you've put together some questions that they can answer honestly.
Exactly.
And it's going to give them some feedback and give you some feedback to see if this is the right procedure for them.
Right. Not everybody has to do the most elegant treatment available.
Yeah.
But if you're facing surgery or more medications, or if you worry about the risks of medications, they are very real, then PainFreeFinally.com will help guide you through that process and let you be in touch with me to specifically say, looks good or no.
Yeah, and I think that's the first step for you watching this video right now. Head to PainFreeFinally.com, get yourself educated, but more importantly, if you've had shoulder injuries, you're in shoulder pain, take the quiz. See if stem cell treatment is right for you, or if it isn't right for you, and see how you can be pain-free finally. Again, head to PainFreeFinally.com, take the quiz, and see how Dr. John Trowbridge can help you to be pain-free. Thanks for watching.